The coronavirus pandemic has forced many countries to close their schools. It's hoped the lack of social gathering will help slow the outbreak. But is distance learning the answer? And how vulnerable are children to this virus? This is Inside Story. Hello and welcome to the program. I'm Deni Nabugeda. The global health crisis created by the coronavirus pandemic has led to extraordinary measures in an effort to contain the outbreak. Countries from South Korea to the US, Italy to New Zealand are introducing measures that are affecting hundreds of millions of people. Schools, universities, cinemas, gyms, concerts have all been shut down around the world. And the U.S. declared a national emergency on the same day its travel ban on 26 European countries came into effect. The World Health Organization says Europe has now replaced China as the epicenter of the outbreak. And governments are approving billions of dollars with the goal of slowing down and eventually stopping the virus. Well, among the containment measures adopted by governments worldwide, many have banned public gatherings. Cambodia and Indonesia are the latest countries to shut down schools in their biggest cities. It comes shortly after major EU countries, including Italy, France, Germany and Spain, imposed similar restrictions. But the UK Prime Minister Boris Johnson has so far refused to follow suit, despite warning the public to be prepared for what he called the worst public health crisis for a generation. Well, before we get into the impact of school closures and the impact they've had on children, let's look at the effects of the pandemic on some of the world's most vulnerable populations, women and children in refugee camps. We can speak to Dr. Apostolos Veizis. He's the director of the Medical Operational Support Unit at Doctors Without Borders in Greece. He's joining us via Skype from Athens. Thanks very much for your time with us on Inside Story and Al Jazeera, Dr. Apostolos. Doctors Without Borders is saying that the overcrowded and horrific living conditions in the hotspot camps on Greek islands provide the perfect storm for a coronavirus outbreak. Can you tell us about the conditions refugees and children are living in and why you believe that the risk of the virus spreading is so high?
Hello from Athens. The situation, it is very difficult and you don't find a word to prescribe what's going on. We talk about camps that are made for 6,178 people, and currently there are more than 42,000 people. Out of these people, about 60% are children and women. We talk about people who don't have shelter. We talk people who don't have access to water and sanitation. And we talk about people who don't have access to healthcare. When it comes to children, we have a lot of children with chronic diseases. In our clinic in Lesbos, we are receiving almost every day 100 children suffering from upper respiratory tract infection, skin disease and diarrhea related to the living condition that these children they have. First of all, children in the Greek islands, they don't have life. They don't go to school. They don't have access to healthcare. They don't have a place to play, and they are suffering from mental health conditions. This situation is a perfect place for spreading of diseases due to the fact that already this population do not have access to healthcare. From July 2019, the Greek government stopped providing to them access to healthcare. So in a situation where you have overcrowding, bad living conditions, bad hygiene, and no access to healthcare, the possibility of a spread of the corona is there.
So what kind of emergency plans are put in place, if there are any, to protect and treat people living in these camps in the case of an outbreak?
Well, first of all, we've been calling for the last 4 years for an evacuation and for decongestion of the camps. So far, there's no emergency plan in place. So even though it's late, I think it's better late than never. It's an opportunity for the Greek government and European Union to focus also on these vulnerable people who, in case of an outbreak, that will be quite in danger. Because from one side, we're calling about people closing schools and talking about people reducing their social activities. But when you have overcrowding and in a place that is made for 2,800 people, you have 200,000 people, what else you expect out of this decongestion? And I think it's important.
Yeah, go ahead.
No, I think it's important that steps are taken place, considering even the status of today, evacuation of the people to the mainland, taking a plan of informing the population, but also supporting the healthcare system that will allow better case management in case the situation goes out of control.
And when you've made that call, and particularly directed it to Greece as well as the other countries in Europe, EU countries, you call for the evacuation of these camps. What's the response that you've gotten from authorities?
The people who are in the camps at the moment are just numbers. So when you make a call for numbers, people will remain numbers. I think it's important that people need to understand beyond these numbers are children, women, and men who have the right to dignity and health. And today, if all the world community is concerned about coronavirus, we have to raise once more that we need to be concerned about these vulnerable people who are exposed. And health without refugees and migrants cannot be considered health. And when we discuss about public health is for everybody who is at the moment in the Greek territory and European territory.
Of course, European officials will say, well, this is all part of Europe's quote-unquote containment policies. So when you make that call for the camps to be evacuated, where do you think that migrants should go to?
First of all, migrants can go both in the mainland in Greece, but also in European countries. And this is for 4 years that we see containment of people based on a political choice. The European Union needs to understand once more that not only in front of emergencies like coronavirus, which is hitting today Europe, but in front of people, they have to treat them with dignity. So there is possibility and opportunities to move them to the mainland and to other European countries in order, first of all, to provide safety and dignity to these people that is being taken away. These people, they are fleeing wars and conflicts, and they are coming in an unsafe environment, and they are risking their lives now in front of coronavirus.
And the Greek government, as we understand it, has suspended visits and activities of non-state organizations in these refugee camps as a preventative measure against the spread of coronavirus. So how does this affect your operations?
Well, first of all, it will affect services for the people, services of information, services that will reduce the possibility of exposure. So for the time being, as MSF, we are there and we'll try to be there. And also I've been calling to the Greek government and have been expressing our willingness to support in their plans. At the moment, management of the coronavirus cannot be done by isolating people and not allowing them to have access to healthcare. So ignoring people, ignoring that they're existing, and ignoring overcrowding in the islands, this is not the solution. Solution is by dealing with that. Even if it is difficult, it's a possibility to deal with that.
All right, Dr. Apostolos Veizis, we thank you very much for joining us from Athens.
Thank you.
Let's bring in our panel now. In Geneva, we have David Hawley. He's the Director General of the International School of Geneva. It's one of the world's oldest international schools with an enrollment of more than 4,500 students. Over in Dover, here in the UK, we have Deb Berry. She's a Senior Advisor for Emergency Response at Save the Children. Thanks very much for your time with us on Inside Story. Welcome to you both. Deb Berry, I'll come over to you first. If you can just give us a general overview of how Save the Children is responding to the outbreak and how concerned your organization is.
As you know, for Save the Children, we operate in 130 countries around the world. And so we have many staff on the ground at the moment who are providing information, especially to the caregivers and to the ministers of education, ministries of education, about how we can prepare children at this time. And part of that is actually working with the parents and the schools to work out if children aren't going to be attending school, then what is the provision that's being put in place for them? And that's the main thing that we're concerned about right now. In many countries, the children who aren't going to school already are beginning to show signs of being really concerned about what will the future hold, especially for the young people who are coming up to exam stages. This is a time when children are trying to decide about what their future will hold. And so that concern is really big for them. For the younger children, there's often the concern for the parents about who will now care for their children if they're not in school. Even here in the UK, even with that decision still pending, there's a lot of concern from parents about how will they manage when their children aren't in school. We know that children rely on their peers for support. And with so much confusion right now and so many rumours about what will coronavirus look like for me and for my family, we also want to make sure that these children have that support, both from their peers but also from their families.
All right. David, as Deb was saying, we've seen school closures taking place in many countries in the form of social distancing, which officials are hoping can contain the spread of the disease. Over in Geneva, where you are, we understand schools are now going to be closed effective on Monday. What is your take on school closures? Do you think they work, and will they contain this outbreak?
Well, I mean, first, of course, I'm an educator first and foremost, and not a public health specialist. But my understanding is indeed the most important step that we can take anywhere where there's an outbreak globally is indeed to limit the spread of the novel coronavirus simply by literally social distancing from each other. And so, as much as we can do a kind of shutdown that was led by the example in China and Wuhan, it's quite possible, and the evidence suggests that's exactly what we need to be doing. And so from the context of schools, so that I'm going to take a very optimistic view here, we want students to ultimately learn how to learn. This is a terrific learning opportunity for them. And in the spirit of student agency, it's something that they can concretely do to contribute to this stop of this outbreak, is to participate by social isolation, essentially staying at home, and ideally having their parents, and of course through online learning, have the community of educators explain to students, why this is actually the most positive thing that they can do during this outbreak.
And as an educator, David, then what do you see are the short-term consequences as well as the long-term consequences of school closures on education?
Well, I think in the very short term, I can speak, as you said in the beginning, we have about 4,500 children that we're responsible for here from about 145 countries, because we are here in Geneva serving the very international population from the United Nations to the World Health Organization. And in the very short run, again, a very optimistic point of view, I have rarely seen teachers learning as intensely as they have over the past 4 weeks, preparing to move our learning from on-campus to online. So I think that the ramp up, both for the teachers and for the students, for this kind of learning is a kind of silver lining that should be one of many tools in the repertoire of all teachers and learners. And now we have suddenly teachers from around the world are using this particular mechanism, distance learning, if you will. And so on the positive side, I think we're going to learn a great deal. I also think that we're going to dial in to deeply understand what is it ultimately that schools bring to children and to communities, and building a terrific humanity, if you will. And so that what is it that we're going to be missing by not being in schools? Obviously, all of the social and emotional learning that's important. And I think going offline is actually going to help us understand exactly what are those things that we need to concentrate when we are together with the students when they return.
Right. Deb, I'll be coming over to you in one moment. But first, David, one more question on this issue of education. And I indeed do appreciate the positivity. I think we all need a little bit of positivity during these times. What is this going to teach us about children's access to education? Won't going online hurt some disadvantaged learners who don't have access to online and who don't have access to technology?
Again, I don't want to overplay this optimistic view, but sometimes when computers come in as the kind of human proxy, we realize the extraordinary limitations, not so much of humans, but of the structures that we have built around, in this case, the provision of education to all children. And of course, if we believe, as obviously we're in the UN, serving the UN, and if we do believe, as our own school believes, that all human beings have equal value, this crisis is shedding an extraordinarily sharp focus on the extent to which we as humans are actually behaving that way. And so, again, taking the optimistic view, what we are all learning about online learning, maybe we can transfer that to what's happening to the lives of children in refugee camps, for example, so that we can provide access for students and children who are in difficult situations. But it's, I think, really an introduction to a deep understanding of what it means to be human, that we are truly interconnected, that we are interdependent on each other. And yesterday evening, when Emmanuel Macron had this great quote, and he said, you know, the coronavirus has no passport, and the coronavirus recognizes no passport. And I think that's a really good message for us to be reflective of. And then with respect to children, I think we also have to recognize that this crisis will end. There is something that they can do. And to have them be empowered, I actually think they have the ability to be the superpowers here, not unlike our observation of Greta Thunberg and the lead on climate change. For some reason, we don't know why, but children are simply not dying from coronavirus. We don't know why that's the case, but since the last study that I read from up to mid-February, with about 1,000 children between the ages of 0 and 19 testing positive for the coronavirus, there was 0 deaths between the ages of 0 and 9, and 1 between the ages of 10 and 19. And I think that it may very well be that young people could be helping out in places like daycare centers, nursing homes and that sort of thing, because if in fact they are the strongest in this case, they could actually be able to make a contribution in a way that adults have never seen before.
Yeah, here's the thing though, Deb, just because it is certainly good news that children are not contracting the virus at the same rate adults are and they're not dying from it, but just because children are not likely to develop major symptoms, research seems to suggest that it doesn't necessarily mean that they won't contract it and then pass it on to adults. And your colleagues, Deb, over in Italy from Save the Children are now saying that there are more than 3.7 million children who are missing out on schools there because of prevention measures. And you brought up this point a little earlier where you said the concern there is by children staying at home, then they could pass on the virus to those who are elderly and more susceptible. So one wonders then, from your point of view, if school closures actually work in preventing the spread.
Right, and it's a really interesting question. We don't quite understand yet how coronavirus is spreading, but there is a concern, and we all know this from children. They pick up lots of different, kind of bugs, and maybe it doesn't affect them directly, but it can, because the elderly and those who are disabled are extremely vulnerable. We are concerned that that could actually spread the virus to other people, if that's where their grandparents now have to take on that caring role for them because the parents are going out to work because the schools are closed for an extended period. I think one of the things that we're also really concerned about is we have millions of children around the world who are reliant on food programs as well within schools, both in the US, the UK, around the world as well. We have so many children who just rely on getting one hot meal a day. That helps them to keep up their energy, keep up their immune system, to be able to actually fight off these bacteria and viruses that are out there as well. And that helps them to concentrate, that helps them to feel better. And so the pressures now that will come on families as children are out of school, the financial pressures, the emotional concerns, the ability to actually then, you're going to have to increase the bills that you pay. And so Save the Children is concerned about that global impact on the family who are already vulnerable. Parents are working extremely hard to provide for their children. And
so
as we change that dynamic...
So to what extent do you think Boris Johnson's decision not to close schools in the UK is based on economic considerations?
I'm sure that's part of the consideration, knowing that many of the workforce, many children have both of their parents currently working, and there are more need for that. And so they're going to have to make a decision about how are parents going to be able to take care of their children. Is one parent going to be able to stay at home? How are those decisions made? Will jobs become prioritized as well? And so I'm sure that is a factor that's coming in. I mean, I wish we did have more information about how these decisions have been made.
It sounds like from the statement that Boris Johnson made, he said that the scientific advice is that it will do more harm than good at this time when referring to the closure of schools. Why do you think advisors in the UK are advising different measures to their counterparts over in Europe, where we've seen school closures in Geneva, where David is, and France and other places?
Yeah. Yeah, and I would love to know what that decision was. I think one of the things that the way that I talk to schools right now, and as our colleagues are talking to schools and to parents right now, is if we do have this window, even if it's just for a couple more days, start putting plans in place on how are you going to actually learn about, how is your child's school going to communicate with you? Are your children going to have online classes? There seems to be right now, I know from my nieces and nephews at the moment, they're learning from the schools that they're going to do online classes. For the younger children, though, those things aren't being put into place. So if you have the opportunity as a parent right now to go into the schools, talk to the teachers about what's the curriculum that the children are following right now, so you can follow that up at home. As we understand more about the way that the government's working, it's a time for parents to be proactive as information changes every day, that we find out about how can we take care of those educational needs and the wider needs as well of children that happen when children go to school. And that's really important when we think about how are children going to keep connected to their friends, those peer relationships. How are you going to make sure that children are in a safe environment? Are they being safeguarded at the moment? Let's not make children more vulnerable as well, as parents maybe have to face some difficult decisions about where to leave their children at this time if they need to continue to work.
David, I see you nodding along with what Deb had to say. Would you like to add on to that? And also, what would be your advice as an educator to parents who are facing some hard decisions right now?
I mean, I know we're talking about coronavirus, but what Deb was sharing is in some ways more of a societal, philosophical observation. It's quite extraordinary to think that the decision on closing schools or not closing schools is based on whether the children's nutrition may be affected. That says more about society today than about the coronavirus, that families are unable to provide for their children. There's some other structural things, again, as I said, that I think the coronavirus is pointing towards. You know, with respect to moving online, again, I think if we are all citizens and the best thinking is that we need to socially isolate, then the schools are part of that overall decision. It's not a separate decision. I don't live in the UK, but I am having trouble understanding, let's say, the decision of Boris Johnson to separate the work that needs to be done to stop the spread of the virus from the decision about closing schools. It all needs to come together, in my view and my understanding. As far as children and parents are concerned, I think that probably the most important thing is to give your children, really regardless of the age, but of course age appropriate, some real calm, reassuring connectivity, and not try to hide this from them. Share with them exactly what is known about the coronavirus. Go frequently to websites like the World Health Organization website or the public websites that are available from most public health services around the world. I've been going to them, of course, daily in my work, and I'm impressed by the videos they have. You can even go to the World Health Organization and take a course for 3 hours long on the coronavirus. And in my view, if you do that with your child, that's very empowering. And although I don't know the numbers, I suspect that the ratio of time spent on social media relative to the amount of time spent looking at websites like the WHO and deeply educating yourself about this virus, if you could make the ratio such that it's higher on these other sites, it's really protective of your child. And if you're acting in a kind of a way that's responding to social media, myths and so on, and not teaching your children to look at facts, look at reason, look at science, and frankly, to show a great deal of love and empathy, that's what parents need to be doing today.
All right.
You know, I know this is a big thing now because it's now a pandemic, but we will either, you know, humanity will fail at this test or survive at this test or become stronger. And
right.
I think that if we take the orientation that how can we take this to become stronger, to work together, that's what we should do with this coronavirus challenge.
It certainly is a big test ahead. On that note, I'll have to leave it there. Thank you very much for joining us from Geneva, David Hawley, and Deb Berry joining us from Dover. We really appreciate your time. And we also had Apostolos Veizis, who I spoke to earlier on. And thank you for watching. You can see the program again anytime by visiting our website, aljazeera.com. For further discussion, you can go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. For myself and the whole team in London and Doha, thanks for watching. Bye-bye for now.